Hi, I'm Dr. Sireesha Reddy, Senior Consultant at Motherhood Hospitals, Hebbal. I've been with Motherhood Hospitals for the last 10 years, working at the Hebbal unit. For the last 25 years, if you really look at it, when we all initially started into Obs and Gynae, maternity was a single specialty unit that was run in nursing homes by most of the doctors who were doing as a private practice. And you would see that there were a lot of challenges in that because it was run by a single person with less support that was 24/7 available for them. And over years, what we've noted is when the corporates have come and taken over this mother and child sector with a lot of these mother and child hospitals that have been developed over the years, you tend to notice that there's a team that comes in place in this. There's a lot of teamwork that happens here. You've got plenty of support around the corner, like 24/7. You have a pediatrician, you have an anesthetist, you have a radiology services that go around. So this actually has made life easier for most of the obstetricians. You tend to notice the work runs very smoothly. There are no hurdles. You do not need to wait for an anesthetist to come and help you out in the middle of the night, which I remember seeing my seniors practicing, or even, for example, my mother-in-law, she used to, struggle to get a pediatrician or an anesthetist in the middle of the night. So they had to make their decisions on delivery depending on the availability of the anesthetist or a pediatrician. But now we are all in a situation or in a place where it's an extremely safer place where we know that the anesthetist is there even in the middle of the night to support us. We do not need to make any decisions that would compromise the care of the patient just because I do not have a pediatrician or an anesthetist that is not readily available at the needed hour. So this actually has changed a lot in the way that we see our practices, and how much of care that we can give to the women has changed a lot over years. From my teachers, what I've learned over the years of my training is, first, do no harm to your patient. You try to do what is needed to your patient rather than being adventurous is what I've been taught with many of my teachers. And till to date, I've been practicing that. And the other thing that I would always ensure is a patient that walks first in my OPD, the first patient that I see in the OPD, and the last patient that I see in the OPD should be given the same care and same attention. That I think for over the years I've been practicing the same. So I would want none of them to be dissatisfied. So that is how I keep ensuring that my patient care goes on smoothly. There have been many, but one that really touched me was this couple who had reached out to me because they've had multiple termination of a pregnancy before they could reach their 5th month because of a neurological condition which was seen in the baby's scans, and which was suggested that could be a progressive condition. So over the last few years before they met me, they used to have these terminations happening somewhere around their 5th month, as soon as they stepped into the 5th month. They reached out to me when they were in their 3rd month, and the initial scans were looking promising. But as the pregnancy advanced, the radiologist did identify subtle changes in the baby's brain. But it was not something that where we would say that it was life-threatening or it was completely not compatible for a healthy life. But we never knew whether it could progress further on or not. So they just wanted some supporting mechanism around them to tell them that it was okay, we can take it a little further to see how far we can take it and when we need to take a call on. So we did do multiple scans for them, supported them through physically as well as mentally also, emotionally also. And touch wood, as the pregnancy progressed, the radiologists were surprised to notice that those changes did not progress further at all, and they were extremely minute changes that could harm the baby in future. They proceeded on with the pregnancy, and they ended up having a healthy live-born girl who literally weighed around 3.8 kgs, which was a normal delivery. The couple were thrilled. I think after 15 years of their married life, they had this child with 4 to 5 pregnancies that they had to lose because of a suspected abnormality. A year later, they bring the child back to me. She was an year old. They brought her, completely healthy child, happy, smiling, running around. And what touched me most was when I asked about her name, they said that they had named her on my name. So that actually really, impressed me a lot and touched me a lot. And what it taught me was, sometimes science is not, always black and white. You have a lot of gray shades into that as well. So at times you just need to take a little step backwards and see what are the patient's feelings also, and try and see how far you can pull them through in their journey and be supportive to them. I think the results follow.